Hello, everyone. My name is Yusof. I'm a consultant rheumatologist and senior research fellow from Leeds. I'm reporting live from Barcelona, Spain, for EULAR 2025 Congress. Today is the first day of the Congress. There have been plenty of abstract presented, and it's been nice to meet up with other colleagues as well. But from work point of view, the one that abstract that caught my eyes was abstract OP0078. So this is a study to see whether if there is any other adjuncts that we can add to improve the long-term outcome of people with lupus nephritis. As we all know, people with lupus nephritis tend to have more comorbidities and also increased risk of cardiovascular disease such as heart attack and stroke. In addition to improving other measures such as blood pressure, diabetes, and etc., if there is any other mean that we can do to help our patient, then that will be most welcomed. Um, uh, about last year, there's been some study looking at adding SGLT2 inhibitor such as empagliflozin, dapagliflozin, and etc. And those studies which tend to use this emulate trial showed that this treatment is potentially could improve proteinuria and also cardiovascular outcome and also the chronic kidney disease progression. So what this study with OP0078 was doing is trying to investigate another diabetic medication, which is the GLP-1 agonist. So basically, this drug tried to mimic the natural incretin hormones, which usually is released after digestion. This then ask the pancreas to secrete more insulins, and hence patient will get reduced appetite and weight loss and so forth. So this study, they use the US database cohort called TriNet X. So what they've done is they took a patient with diagnosis of lupus and on GLP-1 agonist, and also for another comparison is patient with lupus with as GLT2 inhibitor. And what they did is they follow up from the index, which is the diagnosis, and also 3 years after they've been on that medication and do comparison. So because when we compare cohort like this, especially retrospective in nature, there's always tend to be some imbalance in terms of bias. So what they did was they used the propensity matching scoring. So before matching, it is worth to know that those patients treated with the SGLT2 inhibitor had a bit more severe cardiovascular risk, such as hypertension, and slightly older, and also they were of a majority were of Black or African ancestry, whereas people who were on GLP-1 agonists tend to be more of the white ancestry. So after the matching, out of the total of 2,000 patients, only 600 patients were included. Then when they analyzed the data, they showed that people with lupus nephritis who were on GLP-1 agonists had reduced chronic kidney disease progression, reduced mortality, and also reduced heart attack risk compared to people who are on SGLT2 inhibitor. So this is really an interesting finding. Whether this could be potentially one of the adjuncts that we can add to for the treatment of our patient with lupus nephritis. Certainly, there's more validation study need to be done. And potentially, we can also use other databases and trying to do like a emulate trial methods or other methods such as propensity weighting, so that you don't remove a lot of patients, from your pool. And if these all measures seem to be consistent, then maybe we can take that into our clinical practice. I hope you find the summary useful. And do follow us at Room Now across various medium, including YouTube, X, other social media outlets for further content coverage of EULAR 2025. Till we meet again. Bye bye.